Good afternoon. Last lecture we have seen that Dr. Bin explained that regarding the screening and assessment of high risk pregnancy. So just quick brief on those lectures that what we have been discussed about this high risk pregnancy. So that is was a part of high risk pregnancy. It is divided into several parts like obstetrical history revealing whenever mother has any previous history of childbirth, stillbirth, or any previous neonatal death, or any previous premature infarct, it will be considered as an obstetrical history revealing the high risk categories. Then again, there is a history of recurrent abortion can be categorized as a high risk pregnancies. Okay. Then medical history of a mother revealing that the mother has any maternal illnesses or any chronic hypertension or abnormal pap test or any insulin dependent diabetes or any renal diseases or any RH isolation, it will be considered as a high risk pregnancy as well. Even the maternal physical risk factors when we have the incompetent or cervix or any uterine malformation considered as high risk pregnancies. Any other there are rest of other risk pregnancies are current pregnancies like moderate to severe preeclampsia that is considered as due to the PIH, that is pregnancy induced hypertension, any polyhydramnios, any placenta previa, any multiple pregnancies, any abruption placenta, or any abnormal uterine position can be considered as a high risk pregnancy. So, though those are being considered as a high risk pregnancy, has to be receive ANC care in the hospital only. So, if the patient who has any vaginal bleeding, any vaginal infection, any malpresentation of fetus, excess of decrease of liquor, small for date gestation, change of fetal pattern when the mother has low HB less than 10 mg per DL, any poor weight gain or excessive weight gain, BP which is more than systolic BP more than 150 mg per ml of Hg, considered as a high risk pregnancy, and the the patient has to be admitted for the NC care in hospital only. Okay. Apart from this, now we are going to discuss about the risk approach and the screening of cases. So let's discuss about the same. So in the early pregnancy, the things that are been taken into the blood test that can be performed so that we can find the early findings to detect any deformities about the fetus. The blood tests including HB, ABO grouping with RH type, and blood sugar level has to be checked during the first trimester of pregnancy. Excessive weight gain of the mother leads to fluid retention. Even falling the weight can be considered or can be for risk of IUGR, intrauterine growth retardation. Pre-existing of hypertension or PIH can cause risk of mother as well as fetus due to the preeclampsia status. Excess amount of or decreased amount of amniotic fluid in another risk is another risk factor. Whenever there is a risk, excessive amount of amniotic fluid present in the yolk sac, in the abdomen, or in a less amount of amniotic fluid also can be a reason for the risk as well. To identify those risks, we need to perform certain tests that we are going to discuss right now. So the risk factors are the test that we are going to perform is maternal serum alpha fetoprotein. Maternal serum alpha fetoprotein. Alpha fetoprotein for in a pregnant lady, this is the protein which is being released by the unborn child in a yolk sac on the liver, called as alpha fetoprotein. Common Usually, this test is done in a first trimester of pregnancy between 15 to 18 weeks of pregnancy. This blood test mainly done, it's a blood serum test actually, and been done to detect the congenital defects, okay, or the neural tube defects, so that we can early diagnose or early we can find out any spine or any brain related defects of the unborn baby, so that we can terminate the pregnancy accordingly. Or the low volume low value of AFP can be considered as a Down syndrome or Edward syndrome, where we have a chromosomal defects, and we can terminate the pregnancy. So the alpha fetoprotein can be considered to find out the congenital disease of the unborn child. And the time for performing test is 15 to 18 weeks. The exact time to perform this test is the gestation period of 15 weeks to 18 weeks. This is the ideal time where we can test for this alpha fetoprotein. Why we are doing all these tests? To find out the any congenital any disease where we have a neural tubal problem, or any with the low volume of alpha fetoprotein considered as a Down syndrome or Edward syndrome. It's a blood serum test, okay, for the mother. Our next test is your chorionic villi sampling. So when we are testing, this is the first test that we need to perform to find any defect in child, unborn child. Next is your chorionic villi, villi sampling. So this test we need to perform. The test to be performed after 15 weeks, after 10 weeks of pregnancy. More than 10 weeks. Okay, but less than 12 weeks. So when we have been discussing about the sampling, it's a removal small piece of villi, chorionic villi, placenta from the uterus during the early pregnancy to score the baby of to rule out any baby's genetic disorder or defects. Test can be performed under ultrasonic guidance, that means USG guidance procedure it is, and transcervical catheter will be inserted through the cervix, or transabdominal needle will be inserted through the into the maternal abdomen through the uterine wall into the placental tissue. The result will get within 24 hours, okay, and it has to be performed within 21st trimester, more than 10 weeks up to 12 weeks. Okay, the positive test of this chorionic villus indicates abnormalities which helps to terminate the pregnancy. This coronary villi sampling test can be such has a disadvantage, like patient may have a risk of miscarriages, fetal loss, deformities, vaginal bleeding, and even loss of amniotic fluid. That means oligohydramnios can be leads to due to this chorionic villus sampling. Third test is your chordosynthesis. In this cardiosynthesis, fetal samples taken in pregnancy helps to detect any chromosomal abnormalities or any blood affecting disorder. What we are going to do in this test? In this test, a needle inserted through maternal abdomen wall under sonography guidance puncture the umbilical vein of the fetus and collect 0.5 ml to 2 ml of blood, fetus blood, to test. And this test has to be performed after 18 weeks of pregnancy. After 18 weeks of pregnancy. So these are tests need to be performed to find out any deformities which has been there at the fetus. Okay. Then triple test that has to be performed. Combination of triple test, that is maternal serum alpha fetoprotein, HCG, human gonadotrophic hormone, and unconjugated osteral to rule out the Down syndrome. So whenever we have any doubt of a Down syndrome or chromosomal abnormalities for it, we need to perform this triple test as well, which includes maternal serum alpha fetoprotein, HCG, and unconjugated osteral. To rule out the Down syndrome, it is necessary. Where MSFE and osteral level is low and HCG level is high, it's a confirmed sign that baby is carrying Down syndrome. Okay, and this time, the time of the performing this triple test is 16 to 18 weeks. Triple test, which is including maternal serum alpha beta protein, SCG, and cortisol level of fetus. If it is SCG is high and fetal protein is low, even ostrogen level is low, it's a confirmed Down syndrome. So we can take a call to be continued this pregnancy, or we can terminate the pregnancy accordingly. Now, the next procedure that we are going to perform to confirm the defects of the baby, that is your amniocentesis. I'm sorry. Amniocentesis is a in this procedure the aspiration of the amniotic fluid via the transabdominal insertion of a fine needle into the amniotic cavity. So, whenever we require this amniotic procedures to be performed, patient requires general anesthesia. It has to be done under anesthesia. It's an actual process. Local anesthesia can be given to the patient when we are inserting the needle through abdomen wall to the uterine to get the amniotic fluid. Around 20 ml of fluid gets been extracted for the testing and has to be sent for the and it is a culture test, and this amniotic fluid will be tested, will be checked under microscopic, and then chromosomes will be examined for any kind of abnormalities. The most common abnormalities detected are chromosomal disorders such as Down syndrome, Edwards syndrome, that is trisomy, and Turner syndrome, neutral tube defects such as spina bifida and encephalopathy. The test can be identified several hundred genetic disorders. Amniocentesis can also reveal whether the mother or baby is Rh negative or positive. Whenever mother blood group is very important, whether it is Rh positive or Rh negative, whether blood factor is present or not, and whether the baby's lungs are mature enough for him to be born if immediate termination is required. Which means we through amniocentesis we can find out whether baby's lungs are been matured enough or not. या amniocentesis प्रोसिजरवरती आपल्याला समजतं की पेशंटचं बेबीचे लंग्स आहे ते मॅच्युअर झाले की नाही झालं. जर इन केस बेबीचे मदरची प्रेग्नन्सी टर्मिनेट करायची वेळ आली तर त्याचं लंग्स मॅच्युअर झालेले आहेत की नाही हे सो दॅट वी कॅन टेक अ कॉल अकॉर्डिंगली. इवन या प्रोसिजरने या आपल्याला पेशंटचा क्लेफ्ट लिप पॅलेट सुद्धा समजू शकतं. Amniocentesis done during the pregnancy. कधी करतो आपण amniocentesis procedure? We want to confirm indications of Down syndrome and certain other defects. जेव्हा आपल्याला डाऊन सिंड्रोमचं कन्फर्मेशन हवं असतं, जेव्हा आपल्याला डाऊट असतो आपल्याला वी नीड टू कन्फर्म वेदर पेशंट बेबी इज कॅरिंग डाऊन सिंड्रोम, त्यावेळी आपल्याला amniocentesis करणं गरजेचं आहे. ओके, or any genetic